Hi guys, in this video I will be covering the situational judgment of the UCAT and what you should do to get the higher marks. So starting off, you should try to engage the whole team in any group work. This is because everyone's opinion matters, and in order for a group work to be successful, you need everyone's opinion and everyone's contribution. So especially if you're the group leader, you should try to engage the whole team. Next, it is better to ask rather than to state. This is because if you ask someone rather than telling them to do something, they're more likely to listen to that and they're more likely to respect what you said to them. Next, we have you should try to sort the problem locally and directly first before getting it up to higher authority. This is because if you try to sort it out locally, the person is more likely to listen and is more likely to respect you. But if you tell to the higher authority, they are more likely to disrespect that because they won't be happy. Next, we have that if patient safety is concerned or patient confidentiality is concerned, you should act as soon as possible. If patient safety is concerned, patient safety concerned. This is because, for example, if wrong medication is being prescribed, there is a chance that this could potentially harm the patient. Therefore, it is very important that you should act as soon as possible to try and make sure that the patient isn't harmed. Next up is that you should, in most cases, ask the senior member of staff, such as a consultant, for help. For example, if you do not know what to do in a scenario, then you can ask the senior member because they will be more experienced and they will be able to guide you. This is mostly the most appropriate, or at least appropriate in most cases. Next up, if you have made a mistake, you should apologize as soon as possible to patient if that mistake has been made, rather than just going on and trying to avoid apologizing. Next, we have if you're going to be late, for example, if you're in a placement or you're observing or you're shadowing a GP, and if you're going to be late, you should let them know before. So if you're going to be late, let them know. This just comes under the Professionalism Act. If you don't inform the surgery or wherever you're doing the placement that you're going to be late, there's a chance that they might be looking for you, and this just breaks the Professionalism Act. And next up, we have that if someone needs help, such as your friend or anyone, then you should guide them. You should guide them to support groups. This can be anything. This can be, I don't know, the counselor or just any support group, because your friend, it is because they will be the professional at helping someone. It is better to guide them to that instead of trying to help the person yourself. Yes, you can help the person, but if the problem isn't sorted, then you will try to guide them to a support group. Next is that you should make alternative arrangements if two things overlap. So for example, if you have to attend a seminar but you've also got a dissection and the two both overlap, then you should maybe try to contact the seminar people if they have got any alternative dates that they can book for you in order to make sure that you attend the dissection, because well, both of them are important, and if you've committed to something then you should do it, and if you can't attend then you should let them know that you can't, and if they are able to make alternative arrangement, then that would be the best option. And next, if you have made a mistake, then you should document mistake. So you should document the mistakes to prevent the mistake from happening again, and you will have it on record. So if you need, if someone needs this information, then you can just say, you can get the record out and you can say this happened on that date, and this will be much faster and much easier, and you'll be then just recalling from your memory. Next is if, for example, a student or a colleague that you are working with has problems, for example, if they are impairly deaf, then you should make sure that there are arrangements made for that individual so that they can make sure that they understand everything and they are not posing danger to the patients. And lastly, we have that you should wash hands before and after any observations, because this is very important, especially in a GP setting or a hospital, to prevent infections from spreading.